So I'm Kelly Flemming. I'm from the Department of Neurology here at Mayo Clinic. It's a program that we know there are certain risk factors for stroke, but we know that in real life, not all of those risk factors are addressed, either due to physician issues, patient issues, or financial issues. For instance, patient leaves the hospital. Do they fill their prescriptions? Do they take them appropriately? Do they follow up with primary care? Not all of those things happen in real life. And so it's a program to try to bridge those gaps. I mean, I have a particular example of a patient that I saw recently that had at least 7 different risk factors: smoking, heavy alcohol use, didn't take aspirin, didn't take his cholesterol medications he was supposed to. And in the hospital, I could have easily said, these are what you should do, see you later, see your primary care. It turns out he doesn't have a primary care, and so he could have easily been lost to follow up without that continued support of the lifestyle changes and the medication. And so initially I could have said, you need to be on this, and this medication and discharge him. But instead we worked on what his priorities were as his goals, and we started slow. He was agreeable to the aspirin and stopping smoking. So then I saw him 6 weeks later, and we talked about, okay, what are your goals? You've met those. What do you want to work on next? And so by involving the patient in the plan and working with them instead of kind of in a paternalistic sort of manner, I think we engage patients more in their own healthcare plan and meet their goals. Our goal was to see if we could reduce at least one major risk factor to goal by the end of a year, and there was a trend toward that. It wasn't statistically significant because we expected a bigger number, but we saw trends toward less major risk factors, better LDL, which is bad cholesterol, better blood pressure, better maintenance of diet and exercise with that group, even in the small study we had. So it's encouraging that we hope that it will then reduce vascular outcome. It'll reduce further stroke, further MI, rehospitalization, but we haven't proved that yet. And we're going to try to involve more patients in the future to see if we can show that benefit.